Welcome back to What's Now. Right now we are going to focus on heart disease, which unfortunately kills more Americans than any other health issue. How can you manage your cardiovascular risk? Well, let's find out right now.
According to the American Heart Association, heart disease kills more Americans per year than anything else, claiming nearly 700,000 lives in the U.S. last year alone. Joining us now to discuss managing cardiovascular risk options is the Director of Cardiology at State of the Heart Cardiology, Dr. John Osborne, along with his patient, pilot Mike Hodge. Thank you both for being here today.
Thanks for having us on.
Thank you for having us.
Dr. Osborne, why is cardiovascular risk reduction such an important issue for you in your practice, and what challenges do you run into?
Well, simply cardiovascular disease is the leading cause of death. It was the leading cause of death last year. It'll be the leading cause of death in 2021. And it's been the leading cause of death in the United States for decades. So reducing that risk is absolutely critical. And as an example of that, we do know that millions of patients are on medications. This class of medications is called fenofibrates, also known as trichlorotrilipix, that were thought to lower risk. But as it turns out, we did studies in science and show that these drugs do not lower cardiovascular risk. That's an example of something we thought that worked and it doesn't. So that's why it's critical that you have a discussion with your doctor about what is the most current and both FDA approved approaches that will help to lower your risk of a cardiovascular event.
Mike, can you discuss your experience with cardiovascular risk and your journey towards a healthy lifestyle?
I can, and thank you for asking. I like to tell the story a little bit to help other people. Before I had a heart attack, the day I had a heart attack, up until that day, I thought I was very healthy. I was running and exercising and did that morning, in fact, and had the heart attack in the afternoon. And by the time I had the bypass surgery, was sent to Texas back home. I looked through 2 cardiologists, and they both said I'd never fly again. I went to Dr. John Osborne, and he gave me hope and faith and said, there's a possibility and a probability if I'd stay on the course of action that he's going to lay out. And we did. I stayed with the diet. I stayed with my exercise program and continued it, in fact, a little more healthier. And we went on a prescribed medication program that he suggested. And I've stayed with that now for since the heart attack, and I have returned to flight status after 6 months, and I'm healthier now than I ever been. But I think the key is to be aware of your situation before it happens. And I think I have been. Knowledge is king. The more I read, the more I take to John and talk with him about it, the more I'm aware of myself. And since then, I'm very much confident in myself and very much know that I'm in a healthy state.
That's really good to hear. I'm glad that you're doing so well and you're willing to share your journey, Mike. And Dr. Osborne, can you discuss how you work with your patients to make sure they are on the latest treatments to help reduce cardiovascular risk, even if it means changing regimens and behaviors?
Sure, absolutely. Just like flying a plane, you constantly have to make sure your altitude and speed and direction are all correct. And that's really what cardiology is. It's making sure that you're taking into account all of the variables, the science, the FDA-approved medications, in order to make sure that we have a successful landing, if you will. And Mike is a beautiful example of that hope. We've been working now together for almost 20 years. And many times there are challenges. You might have to say, hey, what we thought we were doing in the past, we thought was helpful. As it turns out, we did science, shows it's not. But now let's take the science and then use that science to your benefit. And as an example, these drugs called fenofibrates we thought worked. The FDA literally a few years ago revoked the FDA approval for these drugs to lower cardiovascular risk. So that's an example where you can have a discussion with your healthcare provider and say, is it appropriate? Maybe if you're on a fenofibrate with a statin to lower cardiovascular risk, maybe it's probably time to have a discussion with your healthcare provider about newer science-based, guideline-based, FDA-approved approaches that do further lower the risk of cardiovascular events beyond what statins do.
Mike, tell us about how your life has changed since switching treatment options.
Well, as my medical history has progressed since the heart attack, I have become healthier, I believe. I still have a great attitude at it, and I still stay totally informed. I'm always asking John about different drugs and different medications that we can change to. And he continues to guide me in the FDA prescribed medications that will do the job of lowering my risk of ever having that problem again. And as far as I know, according to my doctor friend, Dr. Osborne, I'm healthier now than I ever been. And I continue to stay that way. So the journey's been good. And I've been very healthy and I've been very positive on it.
Where can we go for more information?
So I encourage people to get up to speed, to get some charts, some navigation on this constantly evolving topic. There's a website called itscleartomenow.com. It's got a lot of great information on the current FDA-approved approaches that we do know translate to less risk of cardiovascular events, strokes, and heart attacks. So that's itscleartomenow.com, a great resource to start with.
Well, thank you so much, Dr. Osborne and Mike Hodge, for joining us today from Texas. We appreciate you both being here with us, giving us this important information about the state of cardiology and giving us hope. Thank you.
Thank you.
Thanks for watching this health episode of What's Now. For more information, you can head to our website, and if it's important to you, it is important to us, so please let us know what content you would like to see. And for more great shows, be sure to stay tuned. I'm your host, Christine Napier. I'll see you next time.